Hey everybody. So this is probably going to be one of my more personal posts here. So this may be more information than you want, and if so, you can stop this video at any time. But I decided to share some information that I've learned along this process and some more details about what the surgery entails. Because honestly, I have a lot of people that ask me about it, and there's a lot of things that I never knew about it. And keep in mind that I work with I'm a physical therapist at a cancer center. I've been working with post mastectomy patients for several years, and I never truly understood what that meant, what was going on, obviously until now. And I've learned a really valuable lesson in this whole process. So I wanted to share what I've learned and the details of what it means to go through what the surgery was that I went through. So essentially, when I first met with the breast surgeon at Moffitt Cancer Center, I was told right from the beginning that the care for me would be what's called a modified radical mastectomy. And this is a really common procedure, and honestly, it's the only procedure I've seen done in my work at Moffitt with the patients that I work with. And what that means is essentially, all right, this is the picture of what they do in a modified radical mastectomy. Essentially, they cut everything out, including the skin and the nipple, and they leave you with a line. So the scar basically looks from your sternum to your underarm. It's a line. There is no reconstruction at that time. It's done initially, and it's usually followed by radiation. And they usually take all of the lymph nodes in the area, in the underarm. From the very get-go, I was really anxious and worried about this procedure. I'm 39, and the thought of this type of surgery, which is so drastic and will forever change the way I feel and look, was scary. And B, the thought of losing all my lymph nodes. I've treated a lot of people for lymphedema, and it can be really debilitating, and it scared me. So one of the biggest lessons that I've learned in this is, although I trust my surgeon, and you need to trust your surgeon before you go under, but there was something that just told me there's got to be another way. Or, is this truly the only option for me? So, if I were to get a second opinion within the same hospital, it would be the same opinion because they all tend to practice under the same standard of care. So I did my research and I reached out, and thank God for Barbells for Boobs, who I was connected to somebody else who gave me the name of Dr. Grant Carlson at Emory University, who's both a plastic surgeon and a oncology surgeon. And so I went up and had my second consult. I thought, okay, before I already had the surgery scheduled for here at Moffitt, and before I went through with it, I wanted to see, I just wanted to hear from someone else that was highly respected that says, yep, that's the best care for you, or no, there's another option. So I will say that a couple times I met with my surgeon here at Moffitt and said, what about, I've heard of this skin sparing technique where you don't have to remove the skin and the nipple, and it's that way you don't have to deal with taking muscle. When they do I should also note that when you do a modified radical mastectomy, the reconstruction process involves taking tissue that's vascular. So it's taking like muscular tissue. They were going to either take it from my lats or possibly my rectus abdominis, which is your abdominal muscles. And of course that would impair my function moving forward. So all of this just scared me. So I went and met with this other surgeon, and in the process of meeting with him, I asked him, am I a candidate for the skin sparing or nipple sparing procedure? And this was something that I asked a few times here, and I was told I wasn't. And I was told I wasn't because in my case, I had two tumors in the breast. I had one on the inside closer to the sternum, and I had one on the outside, which is actually the one that I felt initially. The surgeon here told me that because I had tumors on both sides of the nipples that they were required to remove everything in between. So I was kind of left with the idea that there were no other options. But again, I decided to get a second opinion because I just needed to either hear the same thing from someone else or find out if there was another option. Well, thankfully, when I met with Dr. Carlson, he told me that I was indeed a candidate for that procedure because the two tumors that I had were not connected beneath the surface. So he could indeed remove those tumors safely, and they did, and they got clean margins, and they wouldn't have to have that type of procedure. So in my case, they were able to, and he also did not remove it was not the same standard of care at the other hospital. Every hospital has a different standard of care they go by based on research that they have. So at Emory, he only removed the one known infected lymph node, and then all of the lymph nodes that were connected to it. So it was 7 in total. So again, and so instead of coming out the way that I would have, instead of coming out of surgery like this, I basically came out of surgery with just a scar underneath, and everything else is the same. And in fact, my surgeon was able to place what's called a tissue expander, which the best way to explain it is it's sort of like an empty balloon that is placed underneath the skin, and he filled it with about 100 cc's of fluid to just give the patient a little bit of shape so that I could still feel slightly normal. I never had a lot of shape anyway. So for me, it left me coming out really looking almost the same as I did going in, except that I now have a scar underneath each breast because they did do the procedure on both sides for symmetry purposes. But I just am so grateful, and I just caution anybody out there, if you go through this, or if you're told something you're not sure about it or you're scared about it, it's okay to get a second opinion. And if he had said, yeah, that's exactly what I do, well, then I would have come back down here and gone through the procedure, because at the end of the day, it's about saving my life. And the thing is, they have great outcomes. Both universities have great outcomes. But for me, outcome for me is not just about living, but being able to enjoy my life and do the things that I want to do. I want to throw my children up in the air. I want to wear a bikini on the beach. I live in Florida, and I have a lot more years of wearing a bikini in front of me. And I want to feel sexy again. And I feel like I have been given that option because of the choice I made with this surgery, and I'm so grateful for it. So I just wanted to share that so that people knew what I went through. The only issues I have left now with the surgery is, once I've gone through radiation, I have to wait about 6 months after radiation is done, and then they can replace the tissue expanders with actual implants, and then everything will be done. But that's really for aesthetics. That's not really any longer part of the cancer treatment. But they will do something with the expanders. Are kind of unique because they have a magnet in them that once I'm done with radiation, I can attend clinic where they will actually inject. They can find the injection point of the tissue expander, and they can inject more fluid a little bit at a time, which allows you to gradually expand the tissue until you get to the size and shape that you like, that makes you feel normal and makes you feel good. So it's almost like I get to try out different size implants along the way until I say this one's right. I do not plan on going crazy. I just want to feel normal again and feel pretty again when this is all over, because boy, it sure takes a lot away from you. But I'm grateful that I have that option because of taking a moment to hit the pause button and make sure that I was doing the right thing for me. So I hope everyone's doing well, and I hope that if anybody can get anything out of this, they do. All right, F you, cancer.